Alright everyone, in this video we are going to go over how to administer albuterol via a nebulizer. So albuterol is an inhalation only medicine and we give it for asthma and COPD patients. So our indication to give albuterol is a patient with a history of asthma or COPD who is wheezing. So they have difficulty breathing. When we listen to their lung sounds, we can hear that they have wheezing. So what albuterol does is it works to open up the constricted airways from their disease. That way air can pass through better, they can gas exchange better, which will make it so hopefully they are not short of breath anymore. So in order to give our albuterol, we need to assemble our equipment first. So we're going to get our albuterol. You guys, because of how these are packaged, you won't be able to see it, but this is albuterol sulfate, 2.5 milligrams in 3 milliliters of saline. So 2.5 milligrams is your dose of albuterol. So we'll have our medicine here. And then we will get out and assemble our nebulizer. So in your packaging for your nebulizer, you have a T-piece. Into the bottom of the T-piece goes the medication receptacle. Inside of the medication receptacle, this green piece, this is what makes it so that the medication nebulizes and becomes a mist that can be inhaled. So if this green piece is missing, you're not going to be able to give medication. So that clicks into the bottom of our T-piece. One end of our T-piece, we will put the mouthpiece in. Try not to touch all over this too much. This is going in your patient's mouth, so don't touch all over it, that's gross. In the other end, we are going to attach our corrugated tubing. The corrugated tubing is very important. What it does is, as the medication is nebulizing, any medication they don't inhale gets trapped in the tubing here, so on their next breath, they get more medication instead of it just disappearing out into the atmosphere where it's not going to do them any good. Into the bottom of our medication chamber, we're going to hook up our oxygen tubing. Do not turn on your oxygen tubing until after you put the medication in there. Otherwise you're going to have a bad time because it's just going to spray medication all over the place. So, I'm going to take that off. Now I'm just going to set my chamber down here. I'm going to open my albuterol. You just twist and then just spray this directly into the chamber like so. Okay, once the chamber has the medication in it, screw the top back on. Now we can plug in our tubing and we're going to hook our tubing up to oxygen. Normal dose of oxygen for this is 6 liters of oxygen. So I'm going to turn my oxygen on to 6 liters. Now, you can see at the far end, there's our medication. We can tell that it's misting properly, so it's becoming a mist. And this is what they need to breathe in. So here's little Timmy, our patient. So we would hand this to Timmy and be like, all right, Timmy, I want you to just hold this in your mouth, hold it upright, and take nice deep breaths. Take a deep breath in through your mouth. Try and hold it for a second, and then breathe out through your nose. We want them to breathe out through their nose, because if they breathe out through their mouth, they're going to blow all the medication out of their corrugated tubing, thus defeating the purpose. So either breathe out through your nose, or breathe in, take this out of your mouth, and then breathe out so that way they get the most medication that they can. And just encourage them, nice, slow, deep breaths. Try and get this medication in. It takes 5 to 7 minutes to give the whole thing. Now, if our patient is so anxious, so short of breath that they can't hold the medication themselves, there is an alternate method that we can do. So you can take your non-rebreather and you can pop the reservoir bag off. Put this on real quick, which we shouldn't do, right? We should put the oxygen first. before we put that on. So pop my T-piece off, take my med chamber, attach it to my non-rebreather, set my flow setting again to 6, and then we can put this on Timmy's face, adjust it appropriately. Now Timmy doesn't have to try and hold the nebulizer. It's just on his face and he can breathe it. The downside to this is there's no tubing to catch that extra medication. It's just going to leak out the sides. So they get a little bit less of the medication, but at least they are getting it, as opposed to if they can't hold the tubing, they keep pulling it away from their face, then they're not getting any medication. So this is better than none. So we've gone over our indication for albuterol. One of our relative contraindications to it can be tachycardia. How it works in the body is it can stimulate certain cells inside the body that can raise the heart rate, but also hopefully as we make their breathing better, they become less anxious and their heart rate goes down. So it's a relative contraindication. Check your protocols when you get hired to see. Generally anything above like 140 they say use with caution. Sometimes you can call a physician on med control if you're not sure because they're so tachycardic. Consult with the physician before you give it. Obviously, if your patient is allergic to albuterol, don't administer it to them. But even apnea is not a contraindication. There's a way we can hook this up to, say, a combi tube and still deliver it to them. But usually that is an advanced level skill, not a basic level skill.